Great Day Live on WHAS 11 is sponsored by Dr. Black's Eye Associates.
Indeed.
Your parents probably told you when you were little, remember this, not to sit too close to the TV or you'll become cross-eyed. Well, the good news is that's not actually true.
I'm glad to hear that part because I was told
You were
that a
right
million
there,
times.
weren't you?
Many people do suffer from strabismus. It's crossed eyes. The good news is the condition can be corrected. Dr. Stephen Howell is with us. Hi, Stephen. Nice to have you here.
Bill.
Nice to have you. Now, this is a word I have never heard before. What exactly is this?
Well, strabismus is any type of eye misalignment, or if eyes want to cross in or drift out, drift up, drift down. It's just where the eyes aren't working well together.
Now, I remember when I was very little, a cousin of mine had that, and the only option then was surgery, but it doesn't have to be that radical now.
Sure, we try conservative things first, like glasses or even patching one eye can sometimes get rid of it, but other times surgery is indicated.
Because we're talking about what muscles, the way muscles work. So if you were to patch an eye, it makes the other one, the muscles in the other side work.
Sure, we tell parents if a child had a strong arm and a weak arm, we'd tie the strong arm behind the back or put a cast on it. That's what we do with patching, is we patch the stronger eye to make the child use the weaker eye.
All right, give me an idea of some of the other options available, procedures.
Well, anytime that we're worried about eye crossing in children, the first thing is to get an eye exam. It's something that we don't want the parents to put off. So the first thing is to have a full eye exam to see if the child's farsighted or nearsighted. And if they're very farsighted or nearsighted, sometimes glasses can take care of the problem. If they can't, then we try patching for a little while, and if that doesn't help, then we talk about surgery. So we start conservatively and go less conservative.
Is there a right age to start a procedure? Should the second you notice a problem, or is there? Do they need to be older before they start?
No,
anything?
there's no time that's too young. So we want to see the child as soon as we can. If the parents are noticing a problem, we need to take a look as soon as we can.
All right, how is it diagnosed?
Well, at the office, we do a complete eye exam. We try to make it fun for the kids, and we can tell which eye that they're using and how much they want to cross or drift. And if it does come to surgery, that's an outpatient procedure at the hospital that usually takes about an hour.
And you're talking about moving muscles?
So if the muscle is like a pulley, if it's working over too much, we put it further back on the eye, or we can tighten muscles as well.
All right, and then talk about the overall degradation of eyesight, if this is a problem. Is it if a parent leaves this unchecked, what happens?
It can cause vision loss, and it can cause permanent vision loss. So it's child's brain is pretty adaptable. If one eye is being used and the other eye is seeing something off somewhere else, the child's brain just turns it off. And it's that repeated turning off that can lead to poor vision in one eye and permanent blindness. So that's the main reason why it's important to treat this if parents are noticing it.
Is this about genetics or?
Sometimes it runs in families, but more often than not, it just happens. It's just one of those unlucky.
So we don't know why it happens.
Exactly. It's I phrase it to parents that sometimes it's just the way God made them, and their brain is wanting to make their eyes cross, and we just have to move the muscles on the eye to go against that.
And this will stay with them? It's not something they'll have to have done perhaps as a young adult or even an adult?
Sometimes we have to do the surgery more than once, but it's one of those things that I keep working with the patient until the eyes want to stay straight. So sometimes it does take more than one surgery, but if we don't do anything, it definitely will stay the same. Yeah.
And once you get along in years, though, does this become more dangerous to take on something like this?
No, I have adult patients as well, and that's a big misnomer out there that this is something that cannot be treated in adults, but it can. And I have some of my most grateful patients are adult patients that have been living with, the stigma of an eye that's turning in or turning out or having constant double vision. They're very grateful to have straight eyes.
I would say so. Nice remedy. Stephen, nice to talk with you today.
Thank you. Thanks for having me.
Hey, listen, you can find Dr. Black's Eye Associates of Southern Indiana on 14th Street in Jeffersonville.
Or you can give them a call at 888-EYECARE, that's EYECARE, 888-393-2273. We'll be right back.